now.
Okay, welcome everybody. This is a webinar on research and research and ethics. My name's Gay Dungy and I work at the University of Otago in Wellington, and I teach on the radiation therapy program. We have two guest speakers today, Peter Kench and Paul Kane. So I'll just let you both introduce yourselves first. Peter.
Thanks, Gay. My name's Peter Kench. I'm a lecturer at the University of Sydney. My background is in nuclear medicine science, and I'm currently the course director of the undergraduate diagnostic radiography program here. And I have a number of PhD students working in different areas that involve things like looking at whole body SPECT or dose reference levels for PET CT, or ways of optimizing the dose in CT and hybrid imaging, and positron range correction. And we're also looking at things that pertain to improving image quality for pediatric PET studies as well. Thanks, Gay.
Okay, Paul.
Thank you, Gay. I'm Paul Kane. I'm one of the lecturers at the University of Otago, Wellington. So I teach on the same radiation therapy program as Gay. I am involved in teaching anatomy and imaging, and also contribute to second and third year papers on literature analysis, what we teach our students about research methodologies, that sort of thing. My own lines of inquiry have been largely of an educational nature. I've looked into both patient education in terms of a supportive care by way of education for cancer patients, and also matters relating to education of student radiation therapists. So I'm currently a PhD candidate as well as all that other stuff.
Excellent. So we've got some good experience. So let's start off with when ethics is essential. And can you give us some examples of when it is and maybe when it's not? So,
well, I'll say something there to start off with. So one of the roles I have, I'm very fortunate to have, I'm one of the deputy editors for the JMRS, and I'd say from a publishing perspective, you're better to take the line that you will always need ethical approval for a project, or be told that it's not required if you want to publish. So there are there's some fairly clear guidelines that you could access, for example, on the GMRS website, that part of the Wiley resource. And if you take the overall approach that you're going to need ethical approval for your project, unless you're specifically told not to, then you'll probably cover all your bases. There are some things like clinical audit, or if you've got some kind of a meta-analysis that you're conducting of previously reported data, or you're interested in doing some sort of a review process, well, then those would be, I guess, the most obvious examples where you would be told, no, you don't need ethical approval. But pretty much everything else you're going to have to give some ethical approval consideration to before you, and I'd suggest that would happen before you get too far involved in your project.
So I'd support what Paul says. If in doubt, ask, and if they say it's not required, keep that as evidence and show that to people who may ask later. So the way I think of ethics is it's about protecting people, and protection could be their safety, but it's also could be their own personal information that you're protecting. So just think of anything that involves patient information. That could be demographics, it could be their report, it could be their medical images. Then normally we need to have ethics approval to ensure our protocols are correct or appropriate for making sure that the person's identity and safety is protected. So that's the way I think of it when thinking when ethics might be approved. But it may not only be patients we're thinking about, it could be other medical radiation professionals or medical imaging professionals. And it may also be people who read our films for us and make clinical judgments. They need to be, their identity needs to be protected as well.
Okay. And are there any special considerations you need to make within Australia and perhaps within New Zealand, Paul, that might be?
I guess the jurisdictions are going to be quite different. Certainly in the context of New Zealand, where you're doing your research will have an influence who you would seek approval from. And we also have an added layer in that most, if not all, ethical committees are going to be seeking some detail of how you've undertaken what's called a Maori consultation process. So that's, it's not a permission, but it's certainly, it's an expectation that you have taken into account how your research may or may not impact on Maori. Sometimes it's glaringly obvious, so a lot of health research, when we think about it, there are well documented and described disparities in terms of access to health services, in terms of outcomes from health services for Maori. So an awful lot of work that's going to be done. It's not that hard to make that connection. The difficulty, I guess, is that across New Zealand there are about 100 different iwi, and various iwi will have their own Maori consultation processes or not. Some of them are more straightforward than others. Some of them have a fee that is attracted by engaging in that process, and that's something that has to be done and has to be considered, because one of the questions that an application process for ethical approval is going to ask is, have you conducted a Maori consultation process? And even if you have not yet, any ethical approval will be granted subject to that Maori consultation process taking place. So there's that extra layer which you need to be aware of. In terms of ethics itself, it depends on what you're doing, because if you're looking to conduct research in a clinical setting, then each of our 20 DHBs that are administering the delivery of our public health system will have some kind of process for the granting of ethical approval. And you'll have to work with that. And even if you choose to go through, depending on the nature of your study, you may have to go through the Ministry of Health structure. So the Ministry of Health operates a number of committees. There's usually a committee meeting every week, all year round. And it's administered by, it's basically anything of an interventional nature that committee is going to be wanting to see an application from. So even if you go to one of those centralized Ministry of Health committees for the granting of your ethical approval, you're still going to have to deal with Maori consultation. You're still going to have to deal with the DHB, because the DHBs will then want to conduct what's called a locality assessment. And the locality assessment is not so much about ethical approval, but it gets tied into it because they need to be satisfied that everything that is needed to conduct that research, whether it's purely from the scientific inquiry perspective, or that it has met all the requirements such as ethical approval and Maori consultation, that locality assessment process has to ensure that all those things are in place. So the process can be quite multi-layered, I guess, in the New Zealand context, and we'll probably go back to the points we're making about the first question, which is, if in doubt, ask. So you can, there will be research offices and the DHBs, and it's always good to ask academics because they're, or should be, pretty well informed as to how these things are set up. So they can if they don't know specifically, they'll certainly know the right ways to go and find out things.
Peter, do you want to add?
Yeah, sure. So for the Australian experience, we have, I think for the Human Research Ethics Committee questions, common questions are asked, and fortunately many centres use the same form or questions or method of acquiring that data. So that's one level. And the other nice thing is that if you have your protocol approved in one centre, there's often arrangement between other HERC committees to accept that at different jurisdictions, so Queensland across to New South Wales. But it may not go all the way across the country, so Western Australia may require you to do an ethics application with their HERC, even though they're very similar questions. At a local level, there's a site-specific application, and they go through all the things about who is going to be the principal person in the department, is there money to cover the costs, so they cover all the local issues about implementing the research within their centre. So yes, it's multi-layered. There's a HERC, you get that, often you get that approval first, and then you go on to a site-specific authorisation, which is about implementing that research protocol in that particular centre. So you could be dealing with, if you've got a multi-centre study, you can be dealing with quite a few different ethical organisations, all asking very similar questions in different ways, and sometimes making one aspect of research quite important, whereas another department will focus on something quite different. So you just have to be ready to sort of adapt to what's being required.
Hmm. And what about research with animals?
I've had some experience with research with animals, and I must say sometimes the requirements are much higher because animals do not have the ability to consent. So we need to take much better care, or we do have to take good care of them and make sure that the research that we are performing is valuable and that our methodology actually uses as few animals as required to answer that research question. So I don't think we necessarily think of animal ethics as being something that's simple and straightforward. There is a high standard to be achieved when doing animal ethics applications.
And Caroline's put up a couple of questions. I'm not sure if you can see them. Yep. What about using phantom or data?
So phantoms are no problems, no ethics approvals required if you're working with phantoms. And I think in the case of nuclear medicine, you just need to follow the safe radiation safety practice working with phantoms and X-ray emitting equipment. Human data is different. So I guess the way to think about human data is if there's any chance that the patient could be identified from that data, and that could occur with imaging data or could occur with any of the demographics or reports, then that definitely needs ethics. I kind of think that if you're just doing a dose reference study and you're just pulling the dose information out and nothing to do with the patient data, then you may not need ethics, but once again, you'd need to check with your local ethics committee just to be sure. So if it's data devoid of any human information, then the requirement for ethics becomes quite low. But as soon as you could possibly identify some patients, so say you do dose reference level investigations, but you're also interested in knowing the age of the patient, what their condition was, what their height was, what their weight was, then you're starting to get date of birth, for example, then you're starting to get data that could possibly identify that particular participant. And for our PhD student who was doing PET-CT DRL studies, we did require ethics to do that particular study because he wanted to know more than just the dose value. We wanted to know the demographics as well and information about why the patient was having that procedure. So then it stretched into a different area requiring ethics.
Right. Okay, so what are some of the more challenging aspects, if that's not challenging enough? How long does it take on average? What have you learnt from your first application?
The short answer to that one would be how long is a piece of string, I suppose. It depends on, I guess, the committee or organisation that you're having to go to get approval for your project. I know, for instance, in our institution in Wellington, if you wanted to get approval for a project involving animals, the committee sits every 2 months. So if you need to plan around that accordingly. If you think about our human ethics committee structure that the Ministry of Health runs, then there's a committee that is meeting every week that could potentially consider your application. Within the university, there is a human ethics approval process, and there's a couple of there's monthly meetings of the main committees, and if what you have is considered a low risk study, there can be what are known as expedited processes that will not take anything like as much time, because simply there are fewer people involved and you're not having to wait for a committee to sit. So I see Caroline's question there about what's low risk and high risk, so I perhaps could address that. So on the plus side of that, you don't have to guess usually. Most ethics, once you've discovered where the appropriate place to submit your application to is, it will be a relatively straightforward thing to find out when those committees or groups meet. So those meeting dates will be published, and alongside of that you will tend to find a last date by which you must submit your application for it to be considered at that next meeting. Generally speaking, some of the committees might have a maximum number of applications that they can feasibly consider in any one sitting. So that's something that you could quite happily get in touch with whoever is administering the work of that committee and get some sort of sense of whether submitting this month is going to get you into that meeting, or whether you effectively have a couple more weeks to put your application together because that next meeting's already full up. So again, I think communication and asking if in doubt, but I think as a rule of thumb, you would need to count on 6 or 7 weeks to be getting ethical approval, and then anything less than that is going to be a bonus, I guess. So to address the question about low risk, high risk, and there's one there about specific risk assessment analysis. I guess low risk would be things like, are you going to ask patients about their satisfaction with a particular service? Might be considered low risk, as opposed to we have a new intervention or a new process or a new technique that we're going to use involved in the patient's imaging or treatment process, and that might be considered high risk. So risk might be risk to the patient, or risk might be considered there's a higher risk of, say, the patient's identity becoming known or the patient being identifiable. So risk can mean a number of things, and it's not necessarily about specific physical harm that may come to a patient or a participant, but it certainly would include that. A good example would, or I could give you 2 examples of, I was involved in a project where we were evaluating a supportive care service for cancer patients. So we were asking them to talk about their experiences of making use of that service. And we identified a potential risk that you have patients who were out of active treatment, they were some time down the track from having used that supportive care service, and perhaps from an emotional or psychological point of view, they had moved on, and it was a potential risk that our team going in to talk to them about that might bring up things that would be quite upsetting or distressing for them. So there was a risk of that happening, and I have to be careful how I express this. That's okay as long as you have some process in place to mitigate for that risk. So it's very much about risk management, as opposed to if there is a risk of something, that automatically means you cannot do the study that you want to do. Compare something like that to, I've done work with, I've been involved, run studies that involve students that I'm involved in teaching, and there is a risk there that they feel obliged to say certain things because I am the investigator and I want to hear about things that I'm involved in teaching. So a way to mitigate that is that I've brought in a neutral or an unknown third party who essentially does the data collection, asks the questions and gets the responses from the participants. And you've mitigated for risk in that way, in that you've diffused the whole situation, and you have someone who has no power or perception of power over the person, over the participant that's taking place. Peter, maybe you want to add something there.
Yeah, I might go back to the beginning and just add the how long does it take? And
yeah,
that's a bit of a tough question. I think very few people do research in complete isolation. So you often are working with a group of people, so you have to coordinate that. And I know, for example, if you're working with radiation, you may need to get the medical physicist to look at the radiation dose and write a report for you as well. And often there's quite senior people that need to sign off on the ethics application, and considerations that these days some centres charge money for you to put in an ethics application. So you've got to think about who's going to pay for it and where that money's going to come and how does the money get transferred. So all those pieces take a fair amount of time. So just to even, I find writing the study protocol is really just writing out exactly how you're going to perform the research and mitigate any possible risks involved in the protocol. And so that can take a fair amount of time to actually design a good research study. And then to complement that, you have to then answer very similar questions in the ethics application. And in the ethics application, you may be asked to refer back to your study protocol. What point was that covered in? Which section? How was that raised? So it's a bit of a process, and I don't say that to scare anyone off. I say that to encourage you to allow enough time and not get frustrated with the fact that it is going to take you time. And this is the experience that even very experienced researchers who have done a lot of ethics applications have to spend the time and have to talk to lots of people and to get things done. So there's a lot of work to get the ethics submitted, and then there's the wait for the ethics committee to feed back to you. And I always find they come back with more questions. So you've got another cycle of responses. Usually it's quicker. You're not waiting another month. You can get the responses back to the committee in a faster way. But there's a cycle of further information or changes required to your application that you need to respond to as well. And if you're lucky, you'll get through in 2 correspondences, a submission and a response. But it may take 3. It could take more. You just need to be prepared. And I'm a really poor judge at working out exactly what they're going to be concerned about. It's really hard to predict what they'll want changed, what they think is what is lacking in your application. So my advice is just to put in the best application you can and not get too bogged down in the detail, because there's going to be something that they've taken interest in and that they want further information about, or want you to take a different approach.
Right. And I suppose that leads into a multi-centre kind of study as well. Have you had any experience of those?
Yeah, I've had some experience with those, and I think it goes back to my previous comments. I won't say it again, but multi-centres can be challenging, because you're not talking just to one ethics committee at one centre, and they're group who do the site-specific authorisation. You might be talking to one ethics committee, or if you're going between states that don't have an agreement, multiple ethics committees, but each of the centres involved in that have a site-specific authorisation. You need to make sure you meet their requirements. So it's more difficult, but once again, the type of research you might be doing may require that, and that may be a very valuable aspect to your research to answer the sort of question that you're trying to. So it's worth it, but just be prepared. More time, more people to talk to, and slightly different ways of doing things each time you go to a new centre.
Great, thank you. So what about storing data? How long do we need to store that information for? From questionnaires and...
That's another one of those, it depends. You'll find that, I can only speak from the New Zealand context, but you're usually looking at a timeline somewhere around the 5 to 10 year bracket. You will find, so for example, the university has a policy, or the university that I work for has a policy where data is stored for a minimum of 5 years, and sometimes you need to ask the question, what does minimum mean, because that could then extend out to anything, and it depends a little bit on what you mean by data. So if you've involved people and you've simply been, say, asking questions or taking measurements, then that data is in electronic form and can be stored relatively straightforwardly. It may be that you've asked people to complete a paper form and you need to find a place where you can safely and securely store something for that period of time. If you're involved in a study which requires the collection of tissue samples, you're in a whole other ball game there, because you just can't take files of blood or slides with tissue samples and stick them in a locked drawer in your office. I guess this is where we're going back to this idea that the planning of a study has to include a consideration of the ethical approval process, because when you actually design the study and think about, well, what am I going to do with this data once I've got it, and then look at the specific requirements of the organization that you're getting approval from, that will be starting to inform that. And then you have to think about, well, when we get to the end period, so if there's a period specified, what are we going to do with it? So you'll have to think through, if you've got a principal investigator running a project and you're the principal investigator, and you know that the project's going to be set up and run within a year or 18 months, that's not unreasonable, but the data has to be stored for the sake of argument, 5 years. What happens if you go to a different job in 3 years' time? Have you a process in place? Have you thought that through? Is there some way of controlling? I guess it's like when you watch those crime shows and they have a chain of custody for evidence that's collected. It's a similar kind of process. The thing is, you need to ask for the specifics, and then you need to think through how you're going to meet those requirements.
So I've just putting in an ethics application for some data that relates to children, PET-CT, and they're asking me to save it for 15 years. So I often think of it as the minimum of 5, but for this particular application, they've said 15. And time again, if I've got paper data, I'm often writing in my ethics application that'll be stored in my locked office in the top drawer of a filing cabinet that's locked. So that's quite a common response I provide that's considered acceptable. If I'm working with electronic data, the university has what's called a research data store, which is designed primarily for storing data in a safe and secure manner, and allows you to sort of control who has access to it. It could just be the investigators on that particular project. So that's another common method, and obviously when you delete data from that store, it's gone, and it's not for retrieving. So that's what can occur at the end of the study. Just be mindful that there's a lot of file sharing applications, cloud store applications out there, and you just need to check with your ethics committee and your local researchers as to what's appropriate, because they have all sorts of different things that occur. Like I know with Dropbox, some of the data might be stored across multiple servers internationally. So that may, if it's patient sensitive information, there may be some concern about that it leaves Australia or New Zealand and goes to other file servers. There's things about deleting data off those cloud stores. They don't actually delete. They stay there for quite a long period of time before they actually disappear off the system. So check with your ethics committee or university policy about sensitive data and how it should be stored, because I know when you're using some of the commercial cloud applications, there may be some specific requirements. There's also an Australian product called Cloud Store, which is run by the university's ANZMRRN, and that's quite a trusted and reliable source for storing data and transferring data as well.
Okay. So what happens if you want to change your studies when you're halfway through or need to extend the length?
That's a relatively simple answer. You go back to the body that has granted you approval in the first place, and you submit an application for an amendment to the original application. And provided the amendment is not down to your lack of foresight, most committees and ethical approval bodies are going to be receptive to that. I mean, a lot of people who are sitting in these committees are researchers themselves, so they know that things change, and there has to be some adaptation to those changes. So I would be very surprised if you encountered a body that would not at least consider an application for an amendment. That, of course, doesn't mean to say that simply because you've had a eureka moment or something happens about the project, there's no guarantee that that amendment will be accepted or an amended approval will be granted. But certainly you just go back and ask and say, look, we've discovered, we were wanting to look at A and we've discovered that B is actually quite important as well. We want to be able to collect that data at the same time. Can we do that? Most of the organisations are going to consider that without much of a problem, really.
Look, I agree, Paul. I think we're working with the ethics committee to make sure that the patients and the participants are looked after. So just ask, don't go ahead and make changes. Ask first, get that amendment, and then proceed with the protocol. And the ethics committee is made up of a range of people across the community. Most of them are scientists. So if you put in a good argument and a good case, they're going to find it hard to say no.
Great. So we're coming up with, what would be your 5 top tips for anyone who's preparing a ethics submission?
Do you want me to go through all 5 or just one, and then I'll go through all 5. I've written down 5 here. The first thing I would say is you need to think about ethical approval at the same time as you're thinking about your project. To me, the two sit hand in hand. So before you've finalized your project design, what it is that you're going to do with your study, you must have considered ethics, because if you've considered ethics, that will help to inform the study design, and it will make the process of completing the ethical approval application, it'll make it not easy, but certainly much more straightforward. It will be a more natural progression of things. Something that I've learned is that ethical approval committees are not in the business of trying to stop research being conducted. And I think that's a very popular myth that needs to be debunked. Those committees are in place to ensure that participants are properly protected. That's what their job is. That doesn't mean necessarily that they're trying to stop research. So what that means is you can, in the broadest sense of what I'm about to say, you can ask participants to do whatever it is that you feel you need to ask them to do or to tell you or to take part in order to address the question that you have identified and that you're investigating. The big thing that ethics committees are wanting to see is that when somebody signs up for a project that you're running, that they know what they signed up for, that they can actually make informed consent. That tends to be their overriding consideration. So that being the case, that means the thing that is called the Participant Information Sheet, or PIS, that is key to your entire application. So if in your participant information sheet, it is very, very clear what it is you're doing, why it is that you need to do it, what are the potential consequences to the participant, what you've done to mitigate those potential consequences, how you're going to support them, that you've made it clear that participants can pull out at any time, that their anonymity will be protected as much as possible. All of those things, those reassurances, so that people can make an informed choice. That's all going to hinge on your participant information sheet. So you have to be able to write, not that you're understood, but so that you're not misunderstood. And that to me is key. Third thing would be ask questions from the organization you're seeking approval from before you submit. If you're in doubt, they would much rather be in a situation, by and large, where they're taking queries, answering those, rather than they might look at your study and say, actually, this is a good study, but this and this and this, they're just not right. You haven't addressed them or thought about them. We're going to have to turn you down. They would rather not be doing that. They would rather deal with the issue before it becomes an issue rather than backwards and forwards. I would suggest that much as there may be a temptation to not, but you should always stick to the forms and the formats that the granting bodies provide. It never ceases to amaze me that people allow their creativity to extend to, well, that's the template that they've given me, but I don't like using that format or that font or that size, or I know it sounds really, really dumb, but stick to the confines that they have provided for you. And I think it's also quite useful, depending on the committee, some will have a mechanism for this more so than others, but you should be willing and able to either attend the meeting or ring into the meeting by teleconference or video conference, so that if a committee has questions that might take, as Peter was alluding to, a couple of sets of communication to clarify some things, that if you're readily available and those things can be cleared up at the time, both committee and you will probably appreciate how much simpler that will make the entire process. So be available, and that being available also entails that you understand the study and that you understand what you're doing. So don't send the person to the committee meeting who attended one planning meeting at the very beginning and still doesn't know what the project is about. They need to be able to answer the questions that may come up.
Great.
That's my 5. That's my 5.
Thanks, Paul. Peter,
So,
you've got 5 minutes.
I agree with Paul. Go to the website and make sure you really understand all the information about applying for ethics, because you have to make lots of decisions along the way. Are you doing a low and negligible risk application? Are you doing a full ethics application? They all have different implications. You'll find on the website there's often checklists, and the checklist will guide you through all the things you need to prepare for that particular application. There'll be things like study protocol. There'll be a study protocol template. And as Paul said, use their template. Don't be creative. This isn't the time to express yourself as the word master. Use what they provide. Yeah, and there'll be things like, you know, telling you that you need to provide a cover letter, and in that cover letter, the sort of information that you should provide as well. So become very familiar with the website before you do your first drafting or writing things down, just to make sure. And you'll also be able to look at the timetable for when the next submission is due and when the committee will meet. The other thing that I found really helpful that I wish I knew at the start is how helpful and positive that people are that work for the ethics office. So that they're really, my experience so far is every time I've rung, I've spoken to some great person on the other end who really wants to see me succeed. And they go out of their way to sort of advise you and give you information and point you in the right direction. For a couple of tough questions, I've gone into the ethics office and I've sat down with staff and I've gone through some of the issues and discussed, you know, how I might approach something like trying to get a waiver for consent for a prospective study. And they'll give you guidelines as to what the ethics committee is looking for. Finally, if you are doing something that requires a sound argument to do something slightly different, within the ethics application, there's a whole lot of links to different documents that the ethics committee uses to guide their decision. So for example, there's the National Health and Medical Research Council have a document called the National Statement on Ethical Conduct in Human Research. And there's also another one, Guidelines under Section 95 of the Privacy Act. So recently I was trying to make a case for doing something a little different to the norm, but we thought it was the most appropriate approach for this particular study. So I went to those documents and I read the relevant sections and I based my argument around those particular statements and guidelines. And that meant that I was using the same kind of arguments as the ethics committee. I'm using the same documents they have to go to answer the tough questions. So it gives you an opportunity to build a good case that is based on sound information. And so as you fill out the forms, you often see references to other documents, and follow those references through, and they'll help you sort of fill out some of those sections.
Great. Thank you to both of you. Caroline and Rhonda Joy, do you have any other questions? No?
Just see if I can unmute them.
No, that was a really fruitful conversation and answered all the questions that I had. Thank you.
Great. And really it is about making sure that people are safe. And it's the researcher as well as the participants. And yeah. Great. Okay. Well, thank you very much, Peter and Paul. And we look forward to the next webinar.
Thanks so much, Gay. Thanks for hosting.
Thank you.
Thank you.
You're welcome.